Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, do you have heartburn or reflux? We've got medical and surgical treatments. Vitamins and supplements, are they good or bad for you? Hip pain causes and cures, and spirituality and prayer in health and healing. My first guest to start us off is Dr. Matt Shane, who is a general and minimally invasive surgeon with Lexington Surgeons. Welcome.
Thank you very much.
Well, now I said heartburn and reflux, and the common term is GERD. So tell us what GERD stands for and what are some of the symptoms.
Well, GERD stands for gastroesophageal reflux disease, or sometimes referred to as reflux disease, and really involves the abnormal flow of acid and stomach contents from the stomach up into the esophagus, causing damage.
What kind of symptoms? What might make somebody think that that's what's occurring?
Well, the typical symptoms that one would have with GERD would be things like heartburn, or that feeling of burning in your chest, especially after eating a spicy meal. Some people complain of regurgitation, where they actually feel food or liquids coming up into their esophagus, or possibly even difficulty swallowing, where they swallow but they feel like it gets stuck.
What might be the typical patient that would present with GERD?
Well, really anybody can really suffer from it, but oftentimes it's somebody usually a little bit older than, let's say, a 20-year-old who finds that routinely, almost every other day or every day perhaps, that they start feeling that kind of heartburn or pain after they eat, sometimes within a few moments after they eat, or they may be finding themselves waking up in the middle of the night feeling like something's coming up the back of their throat, or having an awful taste in their mouth that they can't really explain.
What are the things that cause it? I mean, is it diet? Is it weight?
Well, it's really a constellation of things. The three most common causes, first of all, would be things like a problem with the anatomy. In other words, that they have a break in the normal anti-reflux valve that we all have. Other things that can potentiate reflux would be things like weight disease, but also difficulty swallowing or having some kind of motor problem of either their esophagus or their stomach.
Do spicy foods, alcohol, smoking make a difference?
Absolutely. All of those things can unfortunately lower the ability of the esophageal sphincter to prevent that kind of reflux and can make that a little bit more loose. And so things like eating heavily or spicy foods, smoking, unfortunately some of the things we all like to eat like chocolate can also do the same thing.
So if you have these symptoms before you end up at the doctor, or are there things lifestyle that you can do to treat yourself?
Absolutely. The first thing would be, of course, drink alcohol in moderation if you do drink. More importantly than that would also be things like eating within about 3 hours of going to bed. In other words, don't eat your meal and go immediately then to bed, because a lot of times that can potentiate it as well. We all like eating rich and spicy foods, and that's fine in moderation. Not overeating would be a big part of it. And obviously, if you have problems with weight disease or your weight, trying to live a healthier lifestyle and kind of cut that weight down a little bit can certainly help.
Okay, now you can take some medicines for it. We'll come back to that in a minute, but you're a surgeon.
Correct.
So let's say medicines fail. What are there surgical procedures you can do to fix that?
There are indeed, and it's good that you brought up the medical treatment, because that's the first line treatment for really all patients. But in patients that have severe reflux disease, let's say that is not responsive to medical therapy, or somebody that has, let's say, a large hiatal hernia, which we may talk about later, those are the patients that may require a surgical intervention earlier.
So what's the procedure you do?
Usually we do what's called a laparoscopic Nissen fundoplication, or a laparoscopic fundoplication. And what that involves is really using small incisions and laparoscopic cameras in order to fix the anti-reflux valve of the stomach.
And you just wrap the stomach around and
correct. I mean, one of the things we do, without getting too technical in it all, is if there is a hiatal hernia there, we'll fix that at the same time, and then use your own tissues, usually the floppy part of the stomach called the fundus, to wrap around the esophagus to recreate an anti-reflux valve using your own tissues. Okay,
so before you get to surgery, you did mention medicines. What are some medicines that might make that better?
Well, the biggest medicine right now is called a proton pump inhibitor, and that's things from Dexalent or Nexium or Protonix, or there's a whole slew of them really. You may have seen the ads for Prilosec OTC, and that may be a good first-line treatment for most patients with reflux disease. And oftentimes patients will self-medicate when they first feel these kind of symptoms, hearing about it on the TV or the radio. But if it persists despite those kind of initial interventions, they really should see their doctor to try and get an idea if there's other medical treatment that we can do.
Now, I've also heard that propping your bed up, does that really help?
It does help, especially in patients who suffer from nighttime symptoms. Now, obviously, it's not a panacea. It's not going to fix all the problems that you may have, and you may need other medical or surgical therapy. But certainly in the short term, propping the bed up just a little bit, and you don't have to have one of those fancy kind of motorized beds either. Just something as simple as taking, let's say, a 2x4 and putting one underneath the posts of both the head of the bed will cause just enough of an elevation that for most patients, they'll actually get some relief.
Okay, so is there any confusion of reflux with other symptoms?
Oh, absolutely. I mean, all the things we've just described are things that can tie into other things as well. Of course, anybody that has significant chest pain, which sometimes can be a symptom of reflux, but really reflux is not immediately life-threatening, but heart attacks are. And so I would encourage patients with severe chest pains to see their doctor as soon as possible, just to rule out those kind of things.
All right, that's great information. Thanks for coming in. If you've got reflux, check with your doctor. We'll be right back.